There were choices made there that completely biased everything in one direction. And that's when it starts to really look intentional. They
Yes.
chose to set that definition. They chose to not have nuance. They knew that these databases weren't talking to each other. They knew that Pfizer didn't test for transmission in the clinical trials. All these things push things in one direction. And it's not, the most optimistic take would have been, well, it was a pandemic, it was chaotic, mistakes were going to
Right.
be made.
Hmm.
Over and over and over, we see that
Hmm.
these things were not mistakes, they were choices. This was intentional.
All right. We are back with Dave Wayne. He has become a special guest star on Love and Life because we are so passionate and so feeling a sense of urgency to try to help all of us understand more how heavy handed pharma is in all realms of life, sadly. And many of us are starting to see this more clearly. And Dave's journey from psychiatric nurse who was pro pharma, as most psychiatric nurses are, to really examining what pharma was doing to his patients, this standard of care that starts with a medical model and continues with a medical model and ends with a medical model. And once he started questioning that in the psychiatric unit where he was working in the hospital, then went through COVID. We've covered this in a couple of other episodes, which we'll put in the show notes if you want to hear a little bit more about Dave's history. But then starting to question COVID and then getting fired for his stance on COVID, like, hey, maybe I don't want this experimental product in my body. I'd like to see the research first. And then really awakening to many other domains where pharma is is the first response and perhaps not even not that helpful, but in fact harmful to us. But before we talk about all that, Dave, I want to congratulate you because you recently had an interview with one of our favorite organizations. I'm part of Children's Health Defense Indiana. So share with the audience a little bit about Children's Health Defense and how you got that connection and what you were able to share with them on their platform.
Sure. So, Children's Health Defense is a platform of Robert Kennedy Jr. He's as most of your viewers and listeners will know, he's somebody who became concerned about the childhood vaccine schedule and the increase in chronic diseases in children, things like autoimmune disease and autism and that sort of thing. And with his background in reading science and literature and things like that from his career as an environmental lawyer, he started to dive into the research around things like vaccines and was pretty appalled by what he saw. So Children's Health Defense spends a lot of time doing advocacy and trying to raise awareness about just how bad the science is around the childhood vaccine schedule. For example, we were under the impression that clinical trials would last years and years and years and that these things are robustly tested for safety. But a lot of the childhood vaccines, the trials didn't last for years. In many cases, they lasted for days. And these are for products where the manufacturers have absolutely no liability. So hugely problematic. And of course, none of that was available to public scrutiny until a multitude of lawsuits brought some of these things to light. So a lot of nefarious behavior and obfuscation and things that are very anti-scientific going on in that realm.
Yeah, it's that, and that's something for someone who's not a parent. The childhood vaccine schedule, the vaccination schedule, it's CDC recommended, but it becomes more mandatory, so to speak. You can get religious exemptions in most states. You can get medical exemptions if your child has had an adverse reaction to one of these shots. But for many public school systems, you are expected to get all to be up to date on all your vaccinations. And just as an example of just some something that doesn't make any sense is, for example, a hepatitis B vaccine that's given to infants hours after birth, when we know that the only way that people get hepatitis B is through sexually transmitted diseases or using dirty needles when they're doing drugs, intravenous drugs that are illegal. I don't know of any infants that engage in either of those activities, and yet we give this to a child in the first couple hours, if not days of life. Those sorts of questions that then are, to your point, they're not robustly researched with any kind of clinical trials that are legitimate. And then the manufacturers of the vaccines, why pharma wants to get a product on the CDC schedule is because of the 1986 Act that provided them complete immunity from any lawsuits. So if you do sue the government for an adverse event that your child gets from these vaccines, it goes into a government fund that you might get some money payout. But no parent wants, no millions of dollars is going to help your child recover from autism. I mean, it could if they get ABA therapy. That's not conversation for another day. But these are some very, very detrimental side effects that have not been looked at all. So it's a wonderful organization. To your point, RFKJ has had so much experience starting as an environmental lawyer. So he knows how to go after these governmental agencies, which sadly have been captured, the EPA, and in this case, the FDA and the CDC. So what was your topic with Children's Health Defense when you were on their program recently?
So my topic was a conspiracy that's hidden in plain sight. My background isn't just in nursing. I've got some background in computer science too, and I've been interested in hospital software and also interested in our data systems and interoperability. Interoperability is, does this database talk to this database? And if not, that's a problem. So I was looking at a law that was passed by Congress in the same month that I was fired. It's called HR 550. And what it was doing was giving hundreds of millions of dollars to the CDC specifically to address their COVID data around knowing who's vaccinated and who's not. There were 3 laws passed that season that gave over $1 billion to our federal healthcare institutions specifically to look at, hey, do we even know who's vaccinated and who's not? And the incredible cognitive dissonance going on there where they are saying our data is so good that you're fired, but our data is so bad that we need to spend over $1 billion of taxpayer money to try and improve it. It's hard for me to wrap my head around how much cognitive dissonance it takes to accept both those things, but that is exactly what happened. So these laws were passed, and it was to address a long-standing issue going back to the early 2000s, even into the 1990s, about we have these databases and they are set up on a state-to-state basis where they keep track of who's gotten what vaccine. But they all have different data standards. They all have different laws. In some states, if you get a vaccine, whoever gave it to you is required to report it to the state. In other states, they are required not to report it without your explicit consent. And so none of these states have the same rules. None of them have the same data standards. So, you know, when somebody has Android and somebody has an Apple phone, how sometimes text messaging back and forth gets a little goofy. It's like that, except times 50, and everybody's speaking a different language. So these systems don't talk to each other. The CDC has known that for a quarter of a century at this point, and they've been trying to fix it for that long too. So you fast forward to the age of COVID and COVID vaccines, they had no idea who actually got a COVID vaccine and who didn't at a federal level, but they were pretending they did. And they were saying these vaccines are safe and effective. We don't have evidence of breakthrough infections. When we look at hospitalizations, we don't have evidence that most of the people who were hospitalized were vaccinated. So they made a choice there that's hard to not see it as nefarious, because they knew that they had serious problems with knowing who's vaccinated and who's not, but they decided to define an unvaccinated person as somebody who does not have evidence of having gotten a COVID vaccine when they knew that those systems were completely broken. So to give you an example of how completely broken they are, we've had hospital systems who were starting to send out postcards to their patients saying, hey, looks like you haven't gotten a COVID vaccine. You should make an appointment. And they started getting all this feedback from their patients, like, I already got my vaccine. And so they looked in their database and figured out that about 40% of the people who they thought were unvaccinated were actually vaccinated. And when you look at it on a national level, checks out about the same. It's different state to state, but the data is just terrible. The CDC knew the data was terrible, and even though they knew it was terrible, they chose to base policy off of states where the vaccine registry was completely broken. So, for example, there was a study that came out of California in 2021 that it was Los Angeles County, and they said essentially, we're looking at our data, and everybody who's hospitalized with COVID is unvaccinated. And in the study limitations, it said that if our system didn't communicate with the state database, we would count vaccinated people as unvaccinated. But they didn't really, they mentioned it briefly, but they didn't really say how often it might be happening. That study was put up on a pillar by the CDC, and that study was cited by my own hospital CEO when he justified firing us. As it turns out, California had one of the worst state databases. It was constantly crashing because so many different clinics and hospitals were accessing it at the same time. It was just offline most of the time. So for most people, it wouldn't connect, and most vaccinated people would be counted as unvaccinated. So fast forward to my interview with Children's Health Defense, what I was talking about was that over $1 billion that was spent to try and improve these systems, because that was years ago. So how did they spend that money, and what improvements have they made? They go case by case. They basically released a year in review for 2022, like, hey, how's it going? Like, have we improved our data systems at all? And for example, in New Jersey, they're saying we finally got our database of people who've been vaccinated to talk to our database of people who have had COVID. And lo and behold, there's over 1 million breakthrough infections that they all of a sudden identified. So the entire time that we were being told that breakthrough infections are anecdotal and don't believe your lying eyes, when you start to notice that everybody around you who's been vaccinated keeps getting COVID over and over, just ignore that, because at the population level, we know that these vaccines are helping with transmission. Sure, they're not perfect. And all of a sudden, when they were saying that, they knew that those databases weren't talking. They knew that they weren't able to tell who's actually been vaccinated versus who's gotten COVID. And all of a sudden, once these databases are talking to each other, they're seeing over 1 million breakthrough cases in one state alone. In Kentucky, they were patting themselves on the back. We've improved our ability to spot a breakthrough COVID infection by 4,055.5%. So these things went from being anecdotal and conspiratorial to all of a sudden they're saying we're able to actually spot these breakthrough infections now, and it's happening all over the place. So what's astounding to me is this is not like anything that required a FOIA request. This didn't come out of a court case. This is just out there. This is things that are right on the CDC website. This is directly from Health and Human Services. It's like I said, it's the conspiracy hidden in plain sight.
As you know, we've been partnering with the Wellness Company for several months now. And personally, as someone who sadly no longer trusts the vast majority of medical professionals, I am so happy to be able to share the Wellness Company's array of products with the Love and Life community. Dan and I just purchased the Wellness Company's medical emergency kit, which includes vital medications with proven safety profiles like ivermectin, amoxicillin, and Z-Pak. The kit also includes a comprehensive guidebook researched and written by the company's chief medical board, including esteemed doctors who stood up to COVID tyranny, by the way, which is exactly why they've earned our trust. Dr. Peter McCullough, Dr. Harvey Risch, Dr. Drew Pinsky, and Dr. Paul Alexander, just to name a few. Head over to twc.health/lovelife and enter promo code LOVELIFE, all one word, for 15% off your order. That's twc.health/lovelife and promo code LOVELIFE for 15% off your order. We can take charge of our health, and the Wellness Company is here to help us do it. Well, and again, as a COVID dissident who you and I enjoyed a whole lot of vitriol from those saying those anti-vaxxers, they're so selfish, they don't care if they spread, which we knew quite quickly, like you said, breakthrough case became how do you even call it a breakthrough case? Because shortly after, Rochelle Walensky, Fauci, Rachel Maddow are telling us that there's no way if you get vaccinated, it stops with you. You won't get the virus and you won't spread the virus. And both of those were patently false, like clearly false. I believe I've seen recently, because I'm still knee deep in this stuff, that Rochelle Walensky knew for a fact when she went on TV saying that. And I just think about the people on Twitter who were just laying into each other and just cruel. And what people, and again, I'm not trying to play the victim, but we were victimized. It was absurd. It was our fault. And yet the powers that be, the trusting the scientists and the science trademark, were knowingly allowing us to get thrown under the bus, you to get fired. And by the way, all the stats, the hospitals are full of unvaccinated who have COVID really bad, and now we have to put them on beds, which is horrible. Put them on remdesivir, also horrible. But that was happening all with these databases spewing out, not talking to each other, spewing out incorrect information. And correct me if I'm wrong, Dave, but wasn't there also something that if you got vaccinated and you ended up in the hospital, they wouldn't consider you fully vaccinated until 2 weeks after your second jab? Was that also true? So even when they were trying to ascertain if you were vaccinated or not, it wasn't always clear at what time point were you fully vaccinated.
Yeah, that's exactly right. There was a choice made there. So we had two categories. You were either unvaccinated or vaccinated. You were only counted as vaccinated if they had proof that you had received both injections more than 2 weeks ago. Right. And again, their ability to actually access those databases and get that proof was incredibly problematic. But when you look at what other countries did, they added a lot more nuance to have more accurate COVID data. They would have nuance for if you got a second shot, but it was less than 2 weeks ago, they would know that. They also had a separate category for unknown. Do we actually know whether this person is vaccinated or not? Is this person's vaccination status being accurately captured? Other countries chose to identify when they weren't sure whether or not somebody was vaccinated. In our country, if they didn't know for sure that somebody was vaccinated, they were automatically counted as unvaccinated. And that didn't happen a small percent of the time. That wasn't 1%, 5%, 10%. That was some significant amount of people who were being miscounted as unvaccinated when they were actually vaccinated. So yeah, there were choices made there that completely biased everything in one direction, and that's when it starts to really, really look intentional. They chose to set that definition. They chose to not have nuance. They knew that these databases weren't talking to each other. They knew that Pfizer didn't test for transmission in the clinical trials. All these things push things in one direction, and it's not, the most optimistic take would have been, well, it was a pandemic, it was chaotic, mistakes were going to be made. Over and over and over. We see that these things were not mistakes, they were choices. This was intentional.
And that's what I think is so hard for me. And I do want to sit with this for a little bit because, I just had a friend this week. And he's a dear friend for years, since college. And I was through a series of events. I was trying to be playful about, I sent some little meme that I found on Instagram that was just talking about how, so for example, when I got married 12 years ago, I was always anti-pharma. We've had that conversation because as a psychologist, Prozac came out. And my father, again, as we've talked about, lifelong Democrat, had taught me to be very careful and thoughtful and think critically about pharmaceutical relationship to our medical industry. And that's just wise. That was never a conspiracy theorist before. In fact, many people on the left were very hesitant to take ABC medications. They would want to look at some Chinese herbs and some other natural alternatives. People, again, that was a left-leaning position until 5 minutes ago. But anyway, I was just making this joke about how oh yeah, when I got married, I was all carefree and happy. And now I'm like, I don't trust this and I don't trust that. I just was making this kind of joke. And he being on his side of things and a COVID compliant, I guess I'll put it, dissidents versus those who were compliant. He was basically like kind of checking in with me, like, is everyone okay with where you are right now? Because you seem still so wrapped up in this, like can't let it go. And you and I talked about it a little bit last time we spoke, but I guess just as a reminder to those of, I know that many people want to be, like you said, mistakes were made. It was chaos. It was a pandemic. Let's just move on. I just want to remind everyone that I would turn on, which I never watch these shows anyway, but I would see clips and you would see someone like Jimmy Kimmel saying that if you're unvaccinated, you shouldn't get care at the hospital, or you certainly should be triaged, should be the last person in line. We would hear things like from the president of the United States at the time saying it's a pandemic of the unvaccinated. Our patient is wearing thin. Newsflash, you're not my father. No one can, I'm an adult. You can't talk to me this way. But however, we were blamed on national TV. So someone who just lost their uncle or their grandmother from COVID is looking at us and blaming us. This was a level of, and I try to explain, like, did you ever experience that in your life where you turn on the TV and the president said that something that is terrifying the entire country is your fault? Like, I don't think people quite understand. I mean, we had, what was it? Alex Berenson is just going back and forth with some LA Times. You may have seen this journalist who was saying the headline a couple years ago, 2021, during the midst of all this, the push for the jab, was to mock the anti-vax deaths may seem cruel, but it's necessary. Something along those lines. And Alex Berenson went back and forth, like basically like, do you want to revisit this headline? And they doubled down. So there are still people who look at us with anger and fury and harbor this resentment. And I'm still reeling from that. We talked about it. I'm still trying to get my bearings. I'm still trying to, like you said, look at what we've experienced. And I am quite willing to think about the intentional elements of this. I am. And others aren't. And that just puts us in two different camps. And that's very hard with people who, some of my dearest friends, and I'm sure you've experienced the same, especially being a psychiatric nurse, where you have taken a 180 in your position and your philosophy about your profession, and others haven't. And so it's just, it's a lot. And the urgency I feel is because I do believe, as I know you do, that people are still being lied to in so many different realms. And I want to, and I know that it feels to them probably like, we know things you don't, and why don't you wake up? And that feels maybe demeaning, like we're dismissing their take on things. And they look at us and like, you're just all conspiracy theorists now about everything. So I don't mean to come at this from a place of like, I do know things. I want to come from a place of love. And I don't think I'm always successful in that, because I do. It's just like anything. A parent loves a child. And gosh, see, now that's going to sound so demeaning, isn't it? But if you know something because it's your expertise or it's something you've researched extensively and you love someone, you want them to know too. Like I've got 2 friends who are pregnant right now. I don't know how to approach the CDC schedule without putting them, I don't want to put them off, but I'm so deeply concerned that they're going to let their babies, their little innocent, precious babies get jabbed. And then like, oh my gosh, where'd this peanut allergy come from? Oh my gosh, where'd this ADHD come from? So I don't know. I don't know what to say, Dave. I'm just like sharing my heart that it really is coming from a place of love. And I don't think it's always portrayed or received that way. Certainly the media doesn't help because they portray us as being like crazy and just like spewing our nonsense. Go ahead, take it.
I completely relate to all of that. I myself still have an enormous amount of anger about the whole thing, and I don't want to go through my life like that, but we
Exactly.
need accountability. We can't be working and living and raising kids in a system that allows this, in a system
Yes.
where these things happened, they keep happening, and they're going to happen again unless we change something. We need to change something. We need to stay angry and hold people accountable. But on the interpersonal level, like, you don't want that anger to cloud, your relationships with friends when you're worried about them having their kids get the 70 some to 90 some shots that are currently on the CDC schedule. It's It's really hard. It's really hard because it would be way easier to just be like, "Whew, glad all that's over with. Let's move on." But we can't. We can't. We need to hold people accountable. We need to see enormous change in our federal institutions because COVID wasn't an aberration. COVID vaccines weren't a one-off. This sort of thing has been happening for decades and decades and decades and decades, and it just keeps getting worse. So what's the next one going to be? We need to change things now so that we don't find out how bad it can get.
We are thrilled to announce our partnership with Authentics Athletic Apparel, spelled with 2 X's at the end because it's our XX chromosomes that make us female. And contrary to current belief, no amount of hormones, no number of surgeries can change that. And no female athlete should have to compete against men. But at the moment, this is exactly what's happening in both amateur and professional sports. It's not fair, nor is it safe. Wearing Authentics lets us take a stand to support and protect female athletes. And I don't think it's hyperbolic to say it, we're protecting the future of womanhood. Authentics gives 10% of all sales to the Independent Women's Forum, the nonprofit which fights for women's causes, including our right to our own spaces and our right to compete against other women and only other women. Check out Authentics.com and use promo code LOVELIFE for 10% off your purchase. That's Authentics.com, AUTHENTIXX.com, and use promo code LOVELIFE, all one word, for 10% off your purchase. Do you know much about, because one of my dear friends, in fact, the one I mentioned earlier, he's a gay man. And during I think he called me one time. It was the middle of 2021. So, everyone can tell I'm still passionate about it. And in the midst of 2021, I was extra on edge. And we were talking and he just said, I've never heard you like this. And I said, yeah, I've never been in the midst of a global pandemic being blamed for it continuing on, even though mass vaccination in the midst of a pandemic was the worst idea because all it does is prompt the virus to morph and to change. And so we have these variants. Nothing to see there. It's my fault. And I was just going off. And as a gay man, I go, by the way, do you know this is not Fauci's first rodeo? Talk to your older gay friends about AZT. Talk to them about what he did during AIDS. I said, so again, I'm like, can I at least get a gay man to align with me, to consider, like you said, that this is not the first time. It won't be the last unless we hold people accountable. Fauci isn't Lord Fauci, Saint Fauci. Get the bobblehead. Fauci has done this before. He has nefarious means and motivations because he makes money off this. It's very twisted. It's very scary. And I wanted him to call up one of your gay buddies who's 10, 12, 15 years older than us and find out what they think, because there were protests at the FDA or NIH back in the day by gay men who were feeling that they were being denied treatment that was known to be effective for whatever the heck AIDS was, which that's another rabbit hole if you go down that, because I read the entire word for word, millions of pages, whatever RFKJ did with that, really, Anthony Fauci. Every word, the citations are all there. This was something that they were holding back, and just like ivermectin and hydroxychloroquine, holding back known treatments for AIDS and pushing this AZT, which many researchers now believe actually killed people. The HIV virus did not, in fact, kill people. It didn't even go into AIDS. It was the AZT that killed these gay men back in the day.
Well, it's a lot like remdesivir now. I do know about that, though. To bring it back here to Wisconsin, this is going to seem like a bizarre connection, but I will bring it back around to the topic. One of the most notorious serial killers in American history, Jeffrey Dahmer, he was here in Wisconsin, in Milwaukee. He's the guy who would prey on young gay men and adolescents and cannibalize them. So one of the things that Dr. Fauci said on TV as they were trying to untangle what was going on with the AIDS pandemic is he said that he believed that AIDS could be transmitted within a close household, meaning like if you lived with somebody, if you were in close proximity to somebody with AIDS, he thought that maybe it would be able to be transmitted that way. He had absolutely no evidence upon which to base that claim, but he said it on national TV. And at one point, there were a couple cops visiting Jeffrey Dahmer's apartment after some neighbors had called in a complaint. And they knew he was gay, and they could not get out of there fast enough. They were worried about catching the AIDS. And Jeffrey Dahmer had a victim in the bedroom. If they had spent any time in his apartment, he might have been caught before more people were murdered and eaten. But the cops at the time were afraid that they could catch AIDS from being in a gay person's apartment. And might be a stretch to call that Anthony Fauci's fault, but it's not the first time that people in a position of authority have gone on national television and said something without evidence that they got completely wrong that did a lot of harm. Even if it had no impact on how things turned out with Jeffrey Dahmer, him going on TV and saying things like that certainly generated a lot of homophobia and a lot
Absolutely.
Yeah.
Absolutely.
So,
you can't extricate that from the story of that time and the reality that people experienced.
Yeah, people were very afraid. They did not know what they were dealing with, and
yes,
and it was very scary because every single person who was getting AIDS was dying. So yeah.
And again, they would be tested as HIV positive, which reminds me, and I remember RFKJ talked about this in the book. What was positive? What was the metric? Very similar to our PCR tests. And what was the metric? And was it being applied appropriately? Even the inventor of the PCR test said it should never have been used to diagnose whether or not someone had a virus. And the cycle threshold being wound up so high. Again, I'm going to get out of my area of expertise here, but so people were getting false positives all over the place during COVID, and there were perhaps many false positives of HIV as well. I know we talked about different countries had different standards for when you were actually considered positive. So you could have HIV if you were in America, but if you went to Canada, you wouldn't have HIV, all that sort of thing. And that's hugely monumental because if you have HIV and all of a sudden, let's get on some AZT to prevent the AIDS from happening, and then the AZT actually kills you. Oh, but he was HIV positive. He was going to die anyway. Maybe and not. Maybe wasn't even positive in the first place. It just causes anyone who wants to take an honest look at this to start to question everything. And to your point, from the CDC schedule to what we're seeing now as whatever monkeypox they tried to get us all hyped up about that. We've got these bird flus that they're rumors of this and that. It's what, and I love that where we are now, and you hear some doctors that are frustrated, like, we've really lost trust in the medical community. You think? You think? Call me crazy. I haven't been to a doctor in years. I don't know when I'll go back. I'll probably just go to a naturopath, but everything is up. Now I think about as a woman who's had mammograms now I read these books about breast cancer, Dr. Mercola's work. I'm sure you're familiar with him. He had this woman on his podcast about breast cancer, and they're saying that it's very likely that all these mammograms are actually all that radiation is causing breast cancer. Okay. I mean, where does it end? To your point, and that's why we have to hold people to account. We have to remain angry. We have to still be happy people, happy warriors, but we have to. And that's why like having you on and delving into this, I think is important, because if we don't go, come on, we can't just gloss over this, or else we're going to continue with this broken, corrupt, captured medical system that claims to help people. We spend way more on healthcare than any other developed country, and we're sicker and fatter, and it's absurd, which is why I'm so excited about Maha. If Maha can actually, and being at the rally in DC, Rescue the Republic, and I know you guys wanted to go, and I'm sorry we couldn't meet up there.
I'm jealous you got to go to that. I really wish we could have been there. We went to the rally in 2022, the medical freedom rally in Washington, and it was pretty amazing. I do think people are waking up. I do think that even people in the medical establishment are waking up. Something that's pretty interesting, and I can't remember if you and I talked about this before, is that at this point, most doctors are not themselves taking COVID vaccines. Did
Okay.
we talk about that already?
No, we haven't addressed that because I just my mindset, and this could be wrong, and I'm very much encouraged to hear what you're saying. My mindset is still that the doctors are indoctrinated and they just kept their heads down and just kept going along, and they probably still would do that. But you're hearing differently, which is great.
Well, they are still doing that, and they're not talking about the fact that they're not getting vaccinated, but they're not, and we know that from a couple different sources. One is NHS, the National Health System over in the UK. They release data about COVID vaccine booster uptake amongst the NHS staff, and it keeps going down and down and down and down to the point where I think it's only 20 to 30% of their doctors are accepting COVID vaccines at this point. And we know that from places in the United States, like the Cleveland Clinic. They employ about 50,000 people, and they've been releasing studies the past couple of years about the effectiveness of the seasonal COVID vaccine boosters. So they released a study a couple of years ago that made a lot of noise, especially in kind of the dissident community, because it showed a linear relationship where the more COVID shots you got, the more often you got COVID. It was a huge study. It was a study where they actually know who's vaccinated and who's not. And it's a study where they actually are testing people regularly for COVID because these are hospital staff. So they had more people in this study than the Pfizer clinical trials. They actually tested symptomatic people, which is something they didn't do in the Pfizer clinical trials. And what they found was that the more shots you took, the more often you got COVID. So they released that, and it really rocked the boat. When they released the next version of it, they made a change. I think they didn't want to rock the boat as hard. So instead of stratifying people by how often they got COVID by dose, they narrowed it down to just two categories: vaccinated and unvaccinated. So you would only count as vaccinated if you got all your shots, including the most recent booster. If you got shot number 1, 2, 3, 4, booster 5, booster 6, rolled up your sleeve for booster 7, but didn't take booster number 8, you were counted as unvaccinated. So by their own terms, which they redefined in 2021, they redefined what it means to be an anti-vaxxer. By the definitions of the authorities, most doctors in the United States are now anti-vaxxers because most of them are not fully boosted. Most of them did not get the latest seasonal booster.
Oh, and I'm glad you brought that up because that was one thing that as we were talking, I wanted to get to that to where, and that's again, research. I've seen some research again on the Substacks that I read, which again is not common knowledge. It's not something that's going to show up on the ABC News or Nightline or any of these. But you're saying this is a Cleveland Clinic study that actually did get disseminated to the general public? Because again, I've seen some of this research done overseas. So probably 2 years ago, I was starting to get wind of this and believing the sources I trust, saying like Dr. McCullough was looking at some of this research and finding we're to the point now, the more you jab, the more you're going to get COVID. It was pretty clear. But again, I didn't think that those studies were being given any credit around here, but you're saying that this one did.
Oh, this one is this is a much better study than a lot of the population level data, simply because it's a large number of people. It's 50,000 employees, and they actually know who's vaccinated, and they're actually testing people whenever they're symptomatic. These other studies that they did, a lot of the time, they don't know who's vaccinated and who's not, and they're trusting people to test when they're symptomatic, but they don't know if they're taking an at-home test that doesn't actually, A, they're not accurate, and B, they don't know how accurately that's tracked. So this is much better data than all these studies that say that the COVID vaccines are preventing transmission. It's because of the setting, because it's a hospital setting.
Right.
It's a much, much more trustworthy set of data than all these other studies that are based off these garbage immunization information system databases that we know
Right.
don't play together well, that we know they don't talk to each other. We know they're not speaking the same language. We know we have issues like in New Jersey. Oh, when we finally got these two to talk, we found 1,000 or over 1 million breakthrough infections. No, the Cleveland Clinic study is very important because of how robust it is, because of how large and accurate it is compared to all these other studies. But does it break through the mainstream? No. Like people like us talk about it. They'll talk about it on Children's Health Defense. The dissidents will talk about it, but if you try and link to it on Facebook, it'll get shadow banned. You'll be able to see your post, but other people won't. The censorship regime is still alive and well, and it's pretty insane. It's pretty insane how tightly controlled the narrative is. The censorship is real, whether it's about COVID or whether it's about transgender care, for example.
Yeah. So I'm glad you brought it back to what we started the conversation with, which is these databases that aren't talking. And then again, is that a bug or is it a feature? And especially when there was this mass push, so heavy handed. And again, just looking at what that meant for people on a human level, what that did to families, what that did, you can't come to Thanksgiving, you can't come to this party, you can't go see grandma because you're unvaccinated, and all these vaccinated people going and spending time with grandma, and frankly, we're more likely to give grandma COVID. I mean, it's just unconscionable. And again, why we're going to keep having these conversations. I know, again, people who are compliant don't understand how frustrating it is for us to have all of our information censored. Again, when we're trying to come from a pure place of like, we just want you to be aware. We want you to know. We want you to be able to take your health into your own hands. None of this will change, however, until we stop, which is one of Children's Health Defense, their Reform Pharma initiative. One of their 10 pillars is to stop allowing pharma to fund TV advertisements. And of course, even Facebook gets money from pharma. They get donations. I don't know how this all works, but that's going to always influence what will be highlighted and what will be completely censored. So I want to thank you for sharing all that you shared with the Children's Health Defense, and encourage everyone to check out that interview, and also to continue our conversation. If you don't mind, Dave, let's do a part 2 to get into the information about this trans, I'm going to say quote unquote trans. It's really not even accurate. People cannot transition. You can't. I mean, you can do a lot of surgeries, you can take hormones, but you're in every cell in your body, you have an XX or an XY. Anyway, we'll pick that up, and we'll get into that. But thank you so much for sharing. Again, I hope that this is something that people can hear and know we're coming from a place of, we've done some deep dives. This is Dave's area of expertise as a psychiatric nurse. He went through the trenches by being fired during COVID. Just hope that people can be open to what we're trying to share, knowing it's coming from a place of love. Dave, thanks so much for joining us, and I look forward to part 2 of this conversation.
My pleasure. Thank you.